So in this program, typically patients coming in or found eligible have about 12 to 15 medications, and now this year we're actually seeing even more. Patients are on 20 to 25. Our maximum, our limit hitter has been someone who's been on 50 unique medications, almost all of them taken multiple times during the day. And of course, it's no wonder this patient wasn't able to take her medications appropriately. By the end of the day, she had a bunch of pills still left. So the clinical pharmacist from the HAP medication therapy management team contacted this patient. We do everything telephonically, so the patient is not expected to drive in for an appointment, and we do it around the patient's schedule. So the patient tells us, 2 o'clock Wednesday I'm available, so we will call 2 o'clock on Wednesday for that patient. And when she called this patient, the pharmacist spent almost 3 hours on the phone. Now, normally that is not typical. So we don't take that much time of a patient's personal time. But this patient was on 50 unique medications, and it was necessary, and the patient wanted it. The patient didn't want to get off the phone. At the end of that 3 hours, the clinical pharmacist was able to put things together to figure out what works, what doesn't work, what is it that she's having problems. Obviously, cost was huge, couldn't afford taking all these prescriptions, scheduling it, trying to even figure out why they were even on this. Some patients were, some of her medications were started maybe 10 years ago for a side effect of another drug. And that drug's been long gone. But unfortunately, when you go see a doctor, and it's not a physician's fault, the physician only has 15-20 minutes to see you as a patient. So when you come in and you have maybe 3 or 4 comorbidities or disease states, maybe you have diabetes and you have hypertension, you have some cholesterol issues, your focus when you go see your doctor is to address whatever issue. So my sugars aren't controlled or whatever it is. So the doctor's 15-20 minutes is concentrating on your needs. So then if you have a patient who's on 15, 20, or 50 drugs, there's no way a physician has time to go through every single one to figure out, let's try to clean this up. And that's the beauty of this program. This program takes the time to do all that because it's not in a clinic visit, it's outside of that clinic visit. But then they don't do that in a silo. They work with the patient's physicians. Many times it's multiple physicians. They're seeing internists and specialists, etc. And we work with all of them. We do ask the patient for permission, and most patients will give it, that, yeah, please talk to my doctor about this. And they will talk to the doctor and say, here's what we found. This is what works for your patient. This is what they're finding isn't really working, and they're not taking it no matter what we're saying. So based on that, putting it together, here's a new regimen that we developed that seems like it would meet the patient's needs and meet most of our evidence-based needs. When I say most, so it helps them get re-engaged with their health care and with their physicians, and we find opportunities to find lower cost, whether it's generic or other brands, or sometimes even over-the-counter drugs. And so it helps the patient with their costs as well. And then at the end, that's how we improve the quality, reduce the medication errors.